Welcome to another video here at Atlas Natural Medicine. I'm Dr. Sievert and we have Brandy with us once again. And we're going to go over some of the importances of stretching and how that influences your body. But before we do that, we're just going to do just a little bit of background on Brandy, because Brandy has been a patient of ours for many, many years. And then about 3 years ago,
I think it's about 2 now.
About 2 years ago, she had an unfortunate incident and ended up actually herniating and rupturing a disc in her cervical spine, and unfortunately had to go through a surgery with that. And that is what medicine and medical procedures are for, which oftentimes are necessary. But she had to go through and have a surgical procedure done to fuse the vertebra in her mid-neck together, because as this was happening, what were the symptoms when you started having the issues of the ruptured disc? What types of symptoms were you having, Brandy?
I was having extreme pain and a complete loss of sensation and dexterity and function in my hands.
Okay.
And it was kind of like the longer it stays that way, the more permanent it could become. So that was unnerving.
And actually you can see in that chart right behind her, the nerves that come out in this area of the neck are the nerves that are going to go down into the arms and hands, which is oftentimes very common when individuals have injuries to their neck, that they start having weakness of muscles. They may get some tingling, some numbing sensations, electrical shocks, and those are all indications that something is going on in that area of the neck. Oftentimes even individuals that have carpal tunnel syndrome. Oftentimes, particularly if you have carpal tunnel in both hands, it's oftentimes a huge indication that something is going on in this area of the neck. But following your surgery, you had significant improvements after surgery, correct?
Yeah, my first memory of coming out of the anesthesia of the surgery, my first memory is lifting my hands up and feeling my fingers and just being so happy I could feel them again.
Awesome. Yes, having sensation is a good thing. But like anyone can imagine, after you have any type of surgery, there always is recovery period and there's rehab period. Brandy wasn't able to go back to work. She wasn't able to just do her normal activities because she had major cervical. 3 vertebrae were fused together with screws and pins. And there was a rehab portion that had to occur. And this is where we then kind of took over. We started getting her adjusted again chiropractically, being very, very specific and not interrupting the areas that were here. This wasn't just your typical twist and turn and crank the neck. We were very, very precise to make sure that we got just the top bone of that neck adjusted to allow the majority of the motion to be restored in the neck. But then she also did a lot of home activities, home rehab, and we did some soft tissue work with her also. And the reason that we're talking about this is because Brandy is not one of our most flexible patients. She tends to be very, very rigid, and we're going to show you guys today how doing exercises, doing stretching on a regular routine basis can start to help not just with immediate symptoms, but what we see oftentimes with a lot of our patients is our elderly patients that are very, very flexible tend to have way less problems with arthritis, way less problems with joint pain. They tend to be much more mobile, active, and they're 70, 80 years of age and they're still living life. Whereas many of our patients that are 50 or 60 and are extremely rigid because they don't stretch or for whatever reasons, they tend to notice they have a lot of joint pain. They tend to have a lot of arthritis. They tend to have a lot of, just aches and pains all over the place, because as everybody knows, if you don't move it,
You lose it.
you lose it. That's right. So what we're going to do today is we're going to show some different exercises, just a general body exercise of some of the key muscles, the muscles in the bottoms of your legs or the hamstrings, your buttock muscles, some of your lower back muscles here, and then your mid-back, and then oftentimes not just your mid-back, but your chest muscles, because today, in today's day and age, everybody has one of these devices right here. And we all spend way too much time in this forward position. And you will see, if you just go to the grocery store, my wife laughs at me all the time when I go to the airport because I watch people's postures. And the majority of people are walking around like this. So we're going to show you just some simple routines of exercises that you can do right now You can do them with somebody else, or many of these exercises you can even do by yourself and just use a little bit of assistance of like a door frame or some other devices just to help give some resistance in that, okay? So Brandy, let's go ahead and get you to lie down on your back here. And we're gonna start with these muscles of the legs, your hamstring muscles. We're gonna go ahead and lower this one down. We're gonna start with this leg. And obviously, anytime you do any type of stretching exercise, what do you think you wanna do? If you do the left leg, you need to do what? The right leg also. Now, everything is always going to be bilateral. But one of the key things, and right about there, you can probably start seeing her legs starting to twitch a little bit. She's grimacing with a little bit of discomfort in her face there. But what we really want to do is stretch this. So if you can do this with somebody else, what they can do is just support the leg, and then we're going to increase that flexibility, and this can be a very, very instantaneous type result. All I'm going to get you to do is go ahead and push down into my shoulder as hard as you can, and just keep pushing. And this is a specific type of stretching where you have somebody do this for about 10 seconds, and you just keep pushing, because as you're stretching that muscle, and then if you use it, it actually helps to release the tension in the tendons. Go ahead and relax, and now you'll watch, and all of a sudden her leg can go up much higher. And you can do this a couple sets. Go ahead and do that again, and push, and it becomes even harder to push, but as she relaxes, you'll notice that we can continue to go. Well, if we continue to do this long enough, her foot would be over her head. But we'll stop right there. Now we're going to do the other side too. And go ahead, and right about there is where we feel that resistance, right about there. So go ahead and push that leg down into the floor. Good, keep pushing, and relax. And you'll notice how much further her leg is coming up already.
This is amazing.
Now go ahead and do that again. Push down as hard as you can. And relax.
Wow.
There we go. Now if you don't have somebody else to do this with, you can obviously do this, you can oftentimes take a towel or a rope, and you can wrap it around the back of your leg, and you can just hold the resistance yourself as you try and push. But now we're also going to stretch one of your other big muscles, are your buttocks or your gluteal muscles. And this is a very simple exercise where you are going to basically just bend your knee up towards your chest, and then you're going to take your opposite arm and you're going to pull that up towards, you want to try and touch your knee to your shoulder. Hopefully it doesn't touch, but that's the direction that you want to go, so you're stretching all of this right into there, and you hold it for about 10 seconds. And you feel that? And if you want, you can also then go oftentimes just a little bit further, and then you get even further stretch. Okay? And if you do these exercises, you don't need to do many repetitions. The key is really doing it more frequently, meaning daily. And if you just do 1 or 2 repetitions of 10 seconds holding that stretch each, that should be sufficient to help keep those muscles trying to stay limber. Good. And so now go ahead and have a seat, because now we're going to stretch these muscles of the lower back. And first thing we're going to get you to do, you can do this, typically doing it on the floor is better. You don't really want to do this in a bed, in a very soft surface, because you tend to sink down and then it makes it very difficult. But the first thing we're going to do is you're going to go ahead and bend this knee and just bring it down into that position. And then first thing you're going to do this, and you're going to break this into 2 different stretches. One, you're going to stretch towards your knee that's bent, and what you're doing here is you're stretching these, what are known as the QL muscles, or the quadratus lumborum muscles. So go ahead and just flex down towards your knee there. And I'm going to come around the other side here, Brandy. You can probably feel that on this side, correct?
Yes.
Okay. And once again, you can do this on your own, or if you have somebody with you, you can have them just very lightly push a little bit further, fingertip type push, and hold that for about 10 seconds, and then come on back up. Now go ahead and go back down again, and you repeat that. And oftentimes as you're stretching, each time you do it, a little bit further each time, it does become easier. But now we're going to switch, where now you're going to go down towards your leg that's straight, but you're going to try and touch the outer part of your foot with the opposite arm. So you're going to be reaching across, And so go ahead and go down. This is going to stretch two things. It's going to stretch these muscles on this side, and it's also going to stretch the muscles on the inner portion of your hamstrings, the medial aspect. Can you feel that, Brandy?
Yes, I can.
Good. And you'll notice she's not even touching her toes. So we're going to help facilitate that and just go down just a little bit further. Good. And she just manages to touch her toes. Hold that for a few seconds and then release. Good. And now go ahead and go back down again. And you notice that time without even any assistance, now she's touching her toes. So we're going to go down a little bit further. And if you pay attention to where her fingers are, she's actually now got even her fingertips are bent, meaning she's down there further. Come on, back up. And now we're going to do this one more time just to see how far you can go down.
Okay.
And go ahead and do the same thing. And you notice that now she can, and what I want you to do though is reach around towards the outside of your foot. Good, because as you reach out towards the outside of your foot, you get a little bit more of a stretch right in through here. And then if you can stretch down just a little bit of pressure there. Perfect. And then obviously go ahead and switch sides. You feel that, don't you?
Yes.
She's going to be like Gumby here in just a little bit. And we're going to come down towards this side. Good. And then same thing, if you have somebody with you, if you're twinning up with a friend, a family member, they can just put a very light pressure on you. Good. Now come on up. And we can do that one more time. Look at that. Look how much further she just got down. Good job, Brandy. Now you're going to do the same thing, but now I want you, same thing once again with this right arm, you're going to reach towards this opposite side of your foot. Okay? Go ahead and stretch and reach. And you can see that she's just barely touching her toes there. And so, as we do this, go ahead and go back down again, Brandy. And as I push, on this one here, she's getting the stretch on through this right side. And if she holds that for a few seconds. Good, now come back up. And now go ahead and try that one more time on your own.
Okay.
And you notice, look how far her fingertips are wrapping around her toes now, meaning that she's already got increased flexibility in there. So then you just go a little bit further and hold that for 10 seconds. And that will finish up those exercises. So now go ahead and stand up. Your legs should be all nice and wobbly and weak right now. But now what we're going to do is we're going to do two stretches. We're going to work the back side, the mid back, and then we're going to work the chest muscles because those are the ones that oftentimes are being affected with us on electronic devices so much. So the first thing you're going to do is you're going to place your arms out in front of you like that. Good. And you can do this oftentimes just in front of a wall. And what she's going to do is tuck your chin down. Good. And then just reach forward and try and touch your hands to my hand. Good. And you should be feeling that all right in through here, correct?
Mm-hmm.
Perfect. Hold that again for about 8 to 10 seconds. And then relax. Good. And then what you're going to do is you're going to do the same thing, but now you're going to twist your upper body slightly. And now you do the same thing. Tuck your head down, come down, and now as you reach forward, you should be feeling it more on that opposite side, correct?
Yes.
Perfect. And 8 to 10 seconds there. Good. And relax. And then you're going to go off towards this side here. And then down for 8 to 10 seconds also. Perfect. Good. Hold that. Excellent. All right.
It's kind of a workout.
It's a workout, right? And it's just stretching.
Yeah.
But if you were to do all of these without anybody explaining it, it's probably to do this whole routine that we've just going through, it shouldn't really take you more than 6 to 7 minutes. So if you just plan on doing that like every morning when you wake up or even before you go to bed, stretching before going to bed is actually very helpful because then you can fall asleep with your muscles being relaxed rather than at the end of the day everything's tightened up because then you wake up and you're even tighter, okay? So the next thing we're going to do is we're going to go ahead and we're going to work these pectoral muscles here. So we're going to start with this arm here first. And you can use, Brandy's going to use me, you can use a door frame if you like. But what we're going to get you to do, Brandy, is I'm going to hold and support here. And what I want you to do is just kind of twist your body around that way. Perfect. Good. And you can feel right about there is about as far as it goes. So now we're going to do that same thing where you're going to go ahead and push resist against me. Just push, push, push. Keep pushing. Keep pushing. Hold that for 8 to 10 seconds. And you can see that in her face. She's working it. Relax. And now as we do this, go ahead and keep rotating your body around.
Oh, wow.
Look how much further that goes. And that's going to loosen up all of these muscles right in through here. Okay? So now we're going to go ahead and do the opposite side just to keep things balanced. And same thing. Go ahead and...
As far as it's going.
That's good. Okay, good. So now go ahead and push up against, resist. Keep going. Keep going. She's working it hard.
I'm trying.
Good. And relax. And now rotate a little bit further. Good. And you'll see how much further, I mean, we got almost about an extra 20 degrees rotation in there. Perfect. Good. So there is your exercise, and you can see from Brandy, now when you're done stretching, it does tend to make you just be bright and happy and cheerful because it feels good, right?
I feel better. I feel like things are flowing. I don't feel all creaky and...
Fantastic. And you know, she said it right there, as she said, things feel like they're flowing. When muscles are tight and tense, you get less blood flow through the muscles. So stretching, that is one of the benefits of stretching, is it helps to bring blood flow flowing through those muscles so you get proper nutrient supply. So try stretching every day. We're going to check back with Brandy in a couple weeks after she does these stretches on a regular basis, and we're going to see if she's any more flexible in a couple weeks compared to now. Right, Brandy?
Right.
All right. Have a great one.